So my issue has always been is that we need to think deeper into the root causes of things. Hence why I'm root cause obsessed. If you read my papers, they're literally called root cause of this, root cause of that. So I'm constantly asking myself why. And then when I get the answer, I ask, what's the why behind that? Anybody that knows me knows I'm not interested in managing anything. I'm interested in getting to the root cause and fixing problems and then teaching patients how to live, pain-free. That's my goal. So I started to ask myself, how can I help downregulate these people's nervous systems? So I don't focus on the muscles, I focus on their nervous system when I treat neck tension. And when I treat necks in general, especially the ones in here that have usually failed everything, as we hold tension in our neck, we hold tension in our back, our butt, our whole body, So, and they say that the cause of most diseases are actually inflammation. Well, stress causes inflammation, right? So if you don't get a hold of stress, then it can lead to all kinds of horrible things. The nervous system controls the muscular system. So you calm the nervous system down, then the muscular system comes down. So I basically just focused on their nervous system. You have to get control of people's stress, and with tension all over their body, it causes all kinds of craziness, and we're all prone to it, right? So it's something that I couldn't get my patients to meditate. Years ago, I'd ask them to meditate, and they just look at me, like, what? And I was like, so I realized that was a lost cause and that my patients weren't going to do relaxation. Hey everybody, what's up? Physical therapist Dr. Ryan Whelton coming to you from just outside the beautiful Tampa Bay area. If you're new to following me, I got a clinic where, like, most people have failed everything or close to everything or that kind of clinic. And I've learned to get exceptional results within that patient population, as seen in my publications. And you can find those on my website, wheltonmethods.com. And you can read my papers, and I publish protocols on how I get, SI joint, plantar fasciitis, sacral torsion shear, impingement syndromes, all kinds of things better. And you can see the results from that and try it. I also have all of my protocols in my online courses, and that's my Rehab results course on my website. And all of my courses are online. And then I map the body, 1,000 pages of maps of the body. I published it. It's on my website too, wheltonmethods.com, for the myofascial method. So the myofascial method, I mapped about 1,000 pages of maps of the body. You stimulate, like, point here, connects here. If you turn your pronate your hand, and it doesn't connect to your bicep tendon anymore, it connects over here. If you go 5 degrees supination, it connects now in here. If you go, like, extend your elbow a little bit, connects up here. If you go up like that, connects down here. And then also if you move your finger around. Anyways, you don't need to know that. It's not that complex. I mapped it at certain joint angles and angles of pressure, and people all over the world for the better part of the decade have reported amazing results, hence the testimonials that I post all the time of people saying they can dramatically increase range of motion and decrease pain. And I actually have a money-back guarantee for the intro shoulder course. If you cannot relieve the pain of the majority of the people you attempt the method on and increase dramatic range of motion increases, then we give you your money back, no questions asked. I've been doing that for the better part of a decade as well, that guarantee, because people love it. So I also have my sciatica cervical ridic immediate relief course, and then I have my membership. So if you want to join my membership, I'm going to be teaching live. I'll announce it when it's being built out now, and I'm going to be teaching live and on Zoom, where I teach, and we meet regularly, and there's a Q&A, and then people can bring their patients in, and we can go over difficult cases. My goal is to get diagnostically us up here for these patients, and also to get people to be able to apply the right treatment protocol to be able to help these people. That's my goal. So I will let you know, but you can always check my website, wheltonmethods.com, and I'll even have one-on-one mentoring if you want it. So I'm going back to teaching live again, just online in a different way. So anyways, that's that. And then I have my business course, my Rehab Results cash-based model that I based on my Rehab Results course and my courses where we bring the chronic pain patients in and we just apply my protocols and we help them and fix them. So, anyways, that's that. Today, I'm going to be talking about one of, I would say, maybe the most important thing in our culture right now, which is stress. So, it came a point in my career that I realized that with my neck tension patients, so normally, we learn in school like people have neck pain, and we learn the physical therapy way of doing it, right? Physical therapy way of relieving neck pain, right? You strengthen, stretch pecs, strengthen parascapular muscles. But I realized that my patient's pain wasn't going away like every time, and they still had hypertonicity or a tense neck, right? And they usually would have headaches and or TMJ as well. And I realized at a certain point in my career that I needed to work on stress. So my issue has always been is that we need to think deeper into the root causes of things. Hence why I'm root cause obsessed. If you read my papers, they're literally called root cause of this, root cause of that. So I'm constantly asking myself why. And then when I get the answer, I ask, what's the why behind that? What's the why behind that? And I'm obsessive about it. Doesn't make for a peaceful life, but it is what it is. It's allowed me to make discoveries, but, I think about this stuff all the time. So I realized years ago, like with neck tension, that everybody was focused on the muscles. So you go to a massage therapist, they massage it. You go to the doctor, they give you a skeletal muscle relaxant for your neck. You go to a neurologist, they inject it with Botox to paralyze it, right, if you got headaches. But my question is not how do we relax the neck? My question is what causes neck tension, right? What controls the muscles? Because if you don't get to the why behind the neck tension, what controls the muscle tension, then you're managing symptoms. And anybody that knows me knows I'm not interested in managing anything. I'm interested in getting to the root cause and fixing problems and then teaching patients how to live, pain-free. That's my goal. So I started to ask myself, how can I help downregulate these people's nervous systems? So I don't focus on the muscles. I focus on their nervous system when I treat neck tension. And when I treat necks in general, especially the ones in here that have usually failed everything and they're like rocks in their neck, go up to someone, go up to your neck patient and touch their neck. And if they feel like they've been in a car accident and you ask them, have you been in a car accident, which usually they haven't, then the question is why would somebody feel like they've been in a car accident that wasn't in a car accident? And the answer is that's where they're holding their stress. We all hold our stress in our neck. That's one of the places that we hold our stress. So I realized that I had to become proficient at treating the nervous system, at turning the volume down on the nervous system. Also, years ago, so I talk about SI joint all the time, and I talk about sacral torsion shear all the time because I see it all day long in here, and they've usually been butchered by the medical system for herniated discs that they thought was causing the pain. And if you follow me, I'm literally talking about this all the time. I mean, these poor people. So, and they had mechanical pain. I published it in a peer-reviewed journal. You could see all the things that these people tried, and then I just do this protocol, right? And a diagnostic procedure for sacral torsion shear, anterior sacral tilt, as well as SI joint dysfunction. But interesting story is that when I was, I would say probably 10 years ago, I was changing my son, who was an infant at the time, and he was on the changing table. But I never like to learn through my own suffering, but it just, I don't know, I'm not a fan of it. But anyway, so I'm standing there, and I wasn't actually doing anything. I was just making sure he didn't fall off, right? So I just had my hands out type thing. And the next thing you know, my back just goes like this. And I'm like, and I can't walk. And I'm like, yell for my wife to come over to watch my son. And I hobbled into bed where I had to lay there for 3 days. And then it took about 3 weeks for that thing to calm down. But as I sat and I laid in bed, I realized, I was like, how did that happen? Like, I'm a physical therapist. Like, I wasn't doing anything. I was just standing there. How could that have happened to me? And at that moment, I realized that I had been more stressed than normal. I had a lot of stuff going on in my life, and I had been more stressed than normal. And what happened was I had a back spasm. So my back went like this. I got an upslip, out flares, and my sacrum rotated. If you check patients with back spasms, this is what I find and hear all the time, is they have upslip, out flares, and their sacrum rotates. And it was very enlightening for me to see that happen to myself, although it was very painful. I couldn't work for 3 days, patients with back spasms. And I realized that that was stress related. And just as we hold tension in our neck, we hold tension in our back, our butt, our whole body. So, and they say that the cause of most diseases are actually inflammation. Well, stress causes inflammation, right? So if you don't get a hold of stress, then it can lead to all kinds of horrible things. So me, having been a person that had mental illness most of my life, obsessive compulsive disorder, it's like a daily thing to manage the obsessive compulsive disorder is something that is defined as severe anxiety, right? So when you got that, you have to make sure that you're okay on a daily basis, in terms of your mental health. So it's something that I am constantly aware of. I meditate twice a day. I do a muscle tension relaxation meditation. I find that works for me better. Everybody's different, but find that worked for me better. But then also what I found that was huge was somebody I know in my family had anxiety. And I was, so a psychiatrist emailed me about how his practice, he fixed his own SI joint based off of my teachings and tried things for a couple of years. And then was like, yeah, I started checking my psychiatric patients, his own psychiatric patients for SI joint. And he's like, guess what I found? I'm like, yeah, I know, they're in there. They tell me all the time, they get referred to psychiatrists. So anyway, so I said, while I have you here, I said, do you have anything natural for children with anxiety? And he got back to me and he sent me this link to this documentary. It was called The Earthing Movie, right? I was almost mildly offended. Like, what is this? I'm the most open-minded person like ever. And I'm like, what is it? Like, like, what? And anyways, it's got like 10 million views now. It went viral. But anyway, so it's all about the electron transfer from the Earth. It's not woo-woo. It's actually proven. There's published peer-reviewed studies and blah, 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 blah. But now it's an industry online. If you go to earthing or grounding products online, it's like an industry. Anyways, I started sleeping on it. And not only did I notice that my sleep got better, most of my patients would say their sleep improves, but I noticed that I had less stress. And then I started having my patients do it, and I noticed that I could get their neck tension down about 30% just by having them sleep on a pillowcase, grounded pillowcase. You get it on Amazon for $23. And it's pretty amazing, actually. So anyway, so I started doing that with my patients. And then another thing I do is I personally take CBD to sleep, to calm my mind down. And I started recommending CBD to my patients. And I partner with a company, it's called Miriam's. It's on my website, go to wheltonmethods.com. And I partnered with this company. And I find that they have the best CBD. And the thing about CBD is people say, oh, it didn't work or whatever. First of all, it has to have the 0.3% THC, which is legal in every state in the United States. It's not like you don't get high off of it, but it doesn't really work if you don't have that in it. Anyways, so I started recommending that to my patients, and everybody, I would say most of my women patients will tell me 20 to 50 milligrams, some higher. I've seen a woman go up to 200 milligrams to feel a difference. I say you want to feel relaxed. You want to find a dose that makes you feel relaxed with CBD at like in the 2.5 hour mark when it peaks. And if you don't, keep going up. So, and it wears off in 46 hours. So anyway, so I started having my neck tension patients, do the grounding in the CBD in between. The trick to CBD is 3 times a day, even if you're not stressed, 3 times a day. Okay. And that's what I find with my patients. So I have them do 3 times a day CBD. One can be at night before bed at a dose that you feel relaxed at in 2.5 hours. Okay. And my patients, their neck just releases between those two things, grounding and CBD 3 times a day at a dose that they feel relaxed at. And yeah, so I usually can get their neck tension down about 50% with those two natural, cheap things. So anyways, that has been a huge help in my practice to be able to release neck tension. So I would recommend you take a look at that in terms of helping your neck patients, because you can fix, like someone has a facet, or herniated disc in their neck, but like still you'll feel tension in there. People are hypertonicity in their neck, right? So the question is just, why is that happening? Why are the muscles tight? Well, why behind that? The nervous system controls the muscular system. So you calm the nervous system down, then the muscular system comes down. So I basically just focused on their nervous system. And then I have all kinds of more advanced ways in my Rehab results course to help with neck tension, TMJ, headaches that I teach, or in my VIP inner circle. Anyways, that has been a huge help for my patients. And in fact, I don't treat necks without it. Now, I tell you that I see people in here that have usually failed everything type clinic. And what I find is, like I tell you, things that don't show up on X-rays and MRIs, which is why they get stuck in the medical system in symptom management, or nobody can figure it out. I see SI joint, sacral torsion, sacral shear. That usually goes together. And then I see thoracic rib head misalignments, that costovertebral misalignments cause massive sharp pain in their back. Can't see it on an X-ray and MRI. And then I see what I call stress injuries. I see neck tension, TMJ, headaches. Now, you can have mechanical issues or serious issues that are causing headaches, and you can have, disc issues or avascular necrosis causing TMJ. But the ones that I'm seeing in here, they've been to dentists, they've been to neurologists, and nobody can figure it out. And then I just turn the volume down on their nervous system, and then when I do, then they, their muscular tension calms down. Okay. So anyways, yeah, grounding pillowcase and CBD 3 times a day has been a godsend. This kind of thing I put together in terms of my patients. And I'm like, yeah, what if I combine these things? I wonder how effective it would be. And it's natural. And, CBD is an anti-inflammatory, so it's great. And it's worked great for my patients, and I'm forever grateful. If you would like the CBD that I use, it's on my website, wheltonmethods.com, the company that I partnered with. And there's also a discount code on there. It's called Miriam's CBD. So that's that. But you got to get control of people's stress. You have to get control of people's stress. And with tension all over their body, it causes all kinds of craziness. And we're all prone to it, right? So it's something that I couldn't get my patients to meditate. Years ago, I'd ask them to meditate, and they just look at me, like, what? And I was like, so I realized that was a lost cause, and that my patients weren't going to do relaxation. So I decided okay, well, what can I give them? Because we're in a take a pill society, right? What can I give them, right? And those two things, the CBD and the grounding pillowcase from the Earthing movie on YouTube. Watch it. It went viral, and I swear by it. I sleep on a grounded pillowcase every night when I travel. I bring it with me. My whole family bring 5 pillowcases with me. So it's pretty powerful stuff, and it's actually, Tesla said years ago, 100 years ago, I don't need power lines. There's electricity in the earth. I can just tap that. So there's an electron transfer. And when we go to the beach, we feel really relaxed, and we have our feet on the earth. And that has a profound effect, according to the studies, on our nervous system. So anyways, I swear by it. That's that. but you need to address stress, I recommend, with your patients. Or just tell them, hey, I started using this grounded pillowcase, I'm sleeping better, but you should give it a shot. Watch this movie. And people buy them for their family members on holidays and birthdays, and because they're so cheap. Anyways, that's that. The Earthing movie on YouTube. Okay? Watch it. Peace. Love you all.